So calls will still come in as they normally do on a regular basis. People will either call 911 or they'll call our non-emergency number. And we as Waco PD Dispatch, we will answer and process the call like we normally would. But there will be a few things that the dispatcher or call taker will look for in the call to determine if this call would meet the criteria for the mental health, behavioral health clinician to take. And if it does, then we'll transfer that call over to them for them to process.
What it's going to be essentially are they're going to be behavioral health workers that come into dispatch and assist with crisis calls. So the three positions that we're initially hiring for are program manager for this position. This is going to be a clinician, so a licensed professional counselor or a licensed clinical social worker, anyone that may fall in that field, licensed clinician. And then we're going to have a crisis call diversion specialist, so that's going to be the call taker. So the individual, the behavioral health worker who's going to take the crisis call.
Okay. They will screen the calls as they would any other call to determine how we would, respond. And if it meets certain criteria, then we'll be able to get the assistance from the behavioral health personnel to take it.
The third one is EMCOT, so it's the Extended Mobile Crisis Outreach Team. So that's the outreach worker that'll be coming in to do the crisis. They'll receive the crisis call, and then if somebody needs to go in the field, there'll be somebody present.
We have suicide calls. We have calls of people just being in crisis. Sometimes it's just them needing someone to talk to. It's not necessarily the extreme ends of crisis of I want to kill myself. Sometimes it's just people are having a really hard time. Sometimes it's a parent needing assistance with their child as far as parenting, right? Parents get overwhelmed and sometimes just need that extra assistance. However, if there are certain factors that we would look for a police response, say an actual crime took place, we would send police. If we know that there are weapons involved or the person is in imminent danger or to themselves or others, things of that nature, we will still follow our normal protocol and we would dispatch police. The other part of that is that we could still hand the call off to the behavioral health personnel to handle that aspect of it, to keep the caller on the line, talk to them, help them while police are en route to deal with the other components of the call.